So the work I'm doing is about serious mental illness. We're looking at people with serious mental illness and their conditions and seeing how it can improve their lives generally, and looking at what really matters to people with SMI, serious mental illness. And doing that, we had lots of service user questionnaires, staff questionnaires, looking at quantitative data, and what mainly mattered to people was social connection, loneliness, social isolation. Further down the list is housing, employment, physical health. We started with a three-part data review. We looked at quantitative data. We used dialogue here in Hackney, so looking at patient-related outcomes, dialogue scores, indicated social connection, social isolation. That issue mattered to most people. Then we had service user questionnaires, we had staff questionnaires, and again we did a themed analysis of everything that was revealed with the data, and what came out mainly was social connection was a real problem. Later on, housing and finance and physical health. So we organised ourselves around different QI projects within the bigger triple aim, and we looked at what we could do to help social connection and engagement of our service users. We started with one GP surgery, Barton House in the northwest. We looked at their SMI population and looked at who hadn't engaged in their services, so who hadn't engaged for their annual review, which is done at the GP surgery. And one thing we did was go through a list of who hadn't engaged. We brought in the HCAs who were here in the CMHTs, the healthcare assistants, and looked at the whole system where someone was referred to the healthcare assistant for their physical health review, and looked at engagement by doing a deep dive, looking at individual patients and what came out of that. Yeah, so we looked at who we could get involved in Hackney into our different projects that are going on. I'm a resident of Hackney as well as a Hackney psychiatrist, and bringing up my children in Hackney, I knew quite well the local faith group, the local vicar whose space we used to use for my kids' nursery. So I knew him quite well. He's involved in lots of social improvement, social connection projects, including opening up what used to be a disused toilet block. It doesn't sound very sleazy, but it's obviously done up, and it's opened as Liberty Hall. This is going to be a point of connection for the community, involving Jewish Orthodox community that's there, as well as Black British population that's there, and involving them in social connection. Although it's run by the vicar, it's for all of the community. And another external stakeholder that I brought into a different project was cycling in Hackney. So my children cycle in Hackney. There's a club called Cycling Club Hackney, which takes people on cycle rides, and as you're going through different parts, people chat, people that have not met before, might stop off, have a game of basketball, come back, and it's a way of bringing people together, getting people to connect and get involved in community. And so we're bringing CCH, Cycling Club Hackney, into the other project, which involves Liberty Hall, to promote mental health awareness in all these different populations and encourage involvement in the community. Is involved. One of them is very much involved in our another project we have going, which is getting together a patient booklet, something that a service user would have with them about their mental health appointments, their physical health results, as well as psychoeducation information about diet, etc. And anything they wanted to put in. And it's devising and designing this booklet with someone who's going to use it, i.e. a service user. And we have another service user involved who is going to be in our cycling project and co-design with us. It expands rapidly, and there are different projects that are coming off the main project, and so some of it can get quite messy, and it links in with work we're doing around transformation funding anyway. It's to stay focused on separate projects and to divide up into groups of people who will focus on one project to be able to carry it through. That's a way to manage the work, otherwise it just expands very quickly.